All right, welcome to the NACCHO 360 conference session entitled Under the Microscope, Examining Data Modernization in Public Health Laboratories. Today we're going to have two speakers. My name is Mel Corbage, lead specialist with the informatics program at the Association of Public Health Laboratories.
Howdy, I'm Ivan Dudek, the Division IT Liaison for the Texas Department of State Health Services Public Health Laboratory and co-chair of the APHL Data Modernization Subcommittee.
All right, and just to set the stage, I want to make sure that everyone is aware of what a public health laboratory is. There is a public health laboratory that serves every state, territory, and the District of Columbia. These laboratories perform services for the jurisdictions. Many states also have local public health laboratories that range in size from large metropolitan laboratories to smaller facilities that may just serve a region or a community. Sometimes these laboratories specialize in one area, such as either environmental health and food testing or possibly agricultural testing. These laboratories can also perform communicable disease testing, newborn screening testing, and a variety of other public health related testing.
Ever wonder who identifies health threats to keep your world safe and healthy? It's the Laboratorians at public health laboratories across the country. As part of the public health system, these governmental labs work to keep your communities healthy, and they play a bigger role in your life than you may have guessed. Starting with newborn screenings that identify dangerous genetic and metabolic disorders that can cause disabilities or even death early enough to treat them. Laboratorians are disease detectives, working tirelessly to prevent outbreaks by monitoring communities for pathogens that spread through contact with people or your environment, and testing to protect you from foodborne illnesses. Public health labs test drinking and some recreational water for bacteria, parasites, pesticides, and other harmful substances, all as a part of a coordinated health system effort to have fewer sick people and ultimately a more comfortable environment to live in. You may not have heard about them, but in one way or another, their work has affected your life and that of every American. Learn more about how public health laboratories protect your health at aphl.org.
I want to give you some context as well around the APHL Data Modernization Subcommittee. So APHL manages many member-led advisory committees covering a wide breadth of different topic areas, including informatics. We have an informatics committee that has been operational for many years. We advise the board and association on information systems, electronic laboratory messaging, and health information exchange. Each committee has an APHL staff liaison that works with members of the APHL community to further the work of the committee. The Informatics Committee has two main subcommittees that includes the Data Modernization Committee and the Laboratory Data Interoperability and Standardization Subcommittee. Now, specifically looking at the Data Modernization Subcommittee, of which Ivan Dudek is one of our chairs, this committee, launched in January 2025, advises the committee on modernizing public health laboratory infrastructure. We help assess technological capabilities of our different laboratories and their different infrastructure needs. We help identify areas for improvement and help laboratories set a modernization strategy and priorities. We enhance data management methods, support partnerships, and guide governance. So the data modernization landscape right now is very much like this picture. It's a little bit cluttered. There is quite a bit of work that has been done in the last 5+ years to accelerate data modernization within the entire public health landscape. There have been task forces and work groups and summits and all kinds of committees. We've also had lessons learned and resource repositories and libraries and reports and all kinds of stuff. So there's already been, I want to acknowledge there's already been a lot of really great work done in the name of data modernization. So that brings us, I think, to public health laboratories and where they fall within the data modernization initiative. We know that anecdotally, talking to our member laboratories, we've heard a lot of different stories. They're kind of all over the map. We have some, for example, at Utah, we know that they've been working very closely with their public health agency, and the agency has conducted assessments with every program area, including the public health laboratory. They've embedded leadership from the public health laboratory on their data modernization core team, and they've created a recommendation report that's specific to the laboratory. So the lab there feels very included in data modernization planning. We have other anecdotal evidence where the laboratory wasn't even entirely sure who the name of the data modernization coordinator was in their jurisdiction. We believe that a lot of laboratories are probably likely somewhere in the middle. But again, anecdotally, a lot of the labs that we talk to were not entirely sure what their data modernization strategy should look like and what, how they compared to a lot of their peer laboratories. So given this, we decided to launch the Data Modernization Survey. This was the first initiative that the subcommittee decided to take on. And basically we just asked, what does modernization look like in your laboratory? What is the current status? What are your priorities? What are the gaps? What are the goals? What kind of projects are you working on? How do you define data modernization? So we fielded this survey in fall 2025. We sent it out to local, state, and territorial public health labs. We targeted chief informatics officers, interoperability coordinators, and informatics program managers as our respondents. In total, we got about 62 responses from 45 discrete jurisdictions. We're going to spend the next several minutes here kind of describing what the results of that survey was.
All righty, thanks, Mel. To begin with, we surveyed laboratories on their planning and involvement in data modernization activities for their agencies. We found that labs are in many different stages and different places in their modernization journey, but most have similar goals and are working on very similar projects. So as you can see here, laboratory involvement in formal data modernization planning is fairly evenly divided. Roughly a third of respondents have formal roadmaps, a third have some planned activities, and a third are working in what they can when they can. Note that for most agencies, data modernization is an agency-wide initiative. These responses may reflect that some agencies work more collaboratively with their public health divisions, such as epidemiologists, caseworkers, and laboratories, while others may focus on certain areas more than others. Note that only 12% of respondents are on track to meet their modernization goals, and that only 7% are not on track. The wide range of somewhat on track and unsure may reflect the roadblocks of workforce and the uncertainty of funding that we'll be discussing shortly. Next slide, please. So, even given the uncertainty of their roadmaps, public health laboratories are truly burning rubber on the road to modernization. The most common types of projects that are underway are instrument interfacing, data exchange, which are things like eTOR, ELR, so on, and system assessment and replacement. Definitely, instruments and interfacing are the key aspect of laboratory operations, but their impact is frequently overlooked in data modernization guidance and planning. New testing generally means new instruments, and instrument interfacing takes longer than configuring an analysis in the LIMS. Not to mention, getting instrument software and network connectivity through agency IT cybersecurity review can take a considerable amount of time. Old instruments can require special treatment, such as maintaining out-of-date operating systems or having to isolate the devices on the network. Even within laboratories, instrument interfacing is often taken for granted. The project teams tend to focus on the procurement of the instruments and the actual testing and validation of the instruments during project planning. They don't really consider how they're going to actually interface it with their systems. The data exchange projects, such as eTour with providers and ELR with public health entities, are part of the laboratory's fundamental role as the data producer. Being able to share data efficiently and effectively is critical to their core mission. Data exchange projects can be fairly complex and take a considerable time to implement and require constant maintenance and coordination. Each new data exchange requires additional hours of ongoing support as long as that exchange is in place. Now, half of the respondents are conducting system assessments, upgrades, or replacements. These represent significant investments in time and funds, require careful planning, coordination across testing and support areas, development and implementation, and additional workforce roles and support. The assessments for a system replacement can identify gaps, redundancies, and opportunities for automation and improving the workflow, enabling leadership to make more informed decisions and to measure their impact. So, for example, in Texas, we have too many limbs. This is frequently the case with public health laboratories. A new initiative is announced with funding that's specified to that initiative's focus, or a formerly disparate lab may be consolidated in with an existing lab, which causes the laboratory to take on new systems to meet that specific need. Each system requires support and maintenance, which increases overhead. In our case, we migrated one of our large testing areas from their old LIMS to one that's in use by more of the laboratory, which allowed us to reduce licensing and maintenance costs, and then repurpose our old LIMS support staff to support the other system, which actually gives us more hands under the hood. We chose which LIMS to keep by considering each system's adaptability, support model, and sustainability. Next slide. Note on this graph that no labs reported that they had no roadblocks. That's kind of important. Everyone had at least one roadblock. So why are 2 out of 3 labs reporting that they are somewhat on track or not on track? It comes down to workforce and funding. As of last fall, 66% of labs reported that funding uncertainty had a moderate to heavy impact on their data modernization projects. Most depend upon the ELC and FIG grants from the CDC. Only 16% of labs of our respondents had any kind of sustainability strategy if that funding goes away. The ELC Data Modernization Initiative was desperately needed. Infrastructure is the least exciting thing to fund or to work on, yet forms the foundation of everything that we do. The great thing about the DMI was that it prioritized infrastructure, bringing it to the forefront, giving us a chance to address systemic issues and legacy systems before they turn into emergencies. The trouble is, we need a sustainable long-term mechanism for maintaining our workforce and infrastructure, and initiatives by definition are limited in time. Now, regarding workforce, less than half of the responding labs had dedicated data modernization staff. As one of our survey respondents put it, and you should definitely take this to heart, we don't really have DMI staff at labs. We have the same people that help us with the LIMS, connectivity, HIE, etc. The same few people do it all. So this means that the same person who configures the LIMS, builds the ELR interfaces, manages the tickets and validates the systems, even helps with IT procurements, is the same person who's juggling data modernization projects. Next slide, please. And while labs are driving hard to catch up with today's needs, new highways are being built into the future, complete with new challenging rules of the road. Let's take a look at the top 3. TEFCA, the Trusted Exchange Framework and Common Agreement, is an initiative to secure health information exchange. Survey responses indicate limited awareness amongst public health laboratories. 58% not aware, and 24% are somewhat aware. Several laboratories noted that they are still evaluating TEFCA's applicability to their agency, or to their laboratory, or that their agency has not yet developed policies. There's currently no funding to support public health adoption of TEFCA. Public health labs were somewhat more aware of fire, with 45% somewhat aware and 20% aware. No laboratory is currently in production with fire for any public health laboratory use case. This really isn't surprising, as most current pilot projects are focused on vital records and electronic case reporting. As for artificial intelligence, only 1 in 4 labs are reporting that their agency has an AI policy. 3 of our respondents actually are actively using AI in their operations, but notably, not for core laboratory operations, not for testing data that may contain PHI, not with externally available AI, but for support use cases such as managing procedure documents or evaluating workflows. There is a real need to help PHLs figure out how to incorporate AI responsibly into laboratory workflows while safeguarding patient data. It will take time for state and local governments to determine their overarching AI policies, which will then impact public health AI policies. So bear that in mind. This is something which is still in development, and it's easy for things to be overridden. We don't have good, there's no good overview of all the different policies that are going into place and all the different laws that are going into place currently. Next slide, please. So here's a short summary of what we've learned. Here's your takeaways. Data modernization efforts are widespread. Labs are each individually working on the same types of projects, and we are reinventing the wheel again and again. Workforce capacity and funding are the primary roadblocks. Sustainability is that red flashing light on the dashboard. Labs should have a role in their agency's data modernization plans. So this means both the labs reaching out to their agencies and making sure that they're dedicating staff and time to working on them, and also for the agencies to be reaching out to the public health laboratories and seeing what they can do to help assist. Next slide, please. Mel, take it away.
All right, so where do we go from here? The subcommittee has been thinking about this and what our next steps are. I think the biggest message that came out of this survey is that laboratories do not want to go this alone. They're very interested in working with their peers and being able to take advantage of available resources. So a couple things that we want to do is to socialize resources that are already available. Again, looking at that first slide in the data modernization landscape, there are a lot of tools and resources and templates that have already been developed, and we want to make sure that those are socialized really broadly with the public health laboratory community so that folks know that those tools and best practices are available as they start really working on the meat of their data modernization strategies. We also want to increase opportunities for collaboration and peer learning, and whether that's through lunch and learns and webinars or sharing resources that exist, we're going to be working on that. And then we also want to build a library of lab-specific tools and resources. So where it really makes sense, where our data modernization work differs a little bit from public health agencies, where we have modernization projects that multiple laboratories are working on, whether that's LIMS assessments or replacing legacy systems or building inventory management systems and what have you. We want to be able to work on implementation plans and templates for requirements for LIMS. So things where it makes sense to be able to provide templates that laboratories can use as they're working on similar projects. And then most importantly, I want to ask, the folks that are here listening to this session, what you can do to help support data modernization within the public health laboratory that serves your jurisdiction. And basically, it's making sure that the lab is included on your plans and any kind of strategic work that you're doing for data modernization. Make sure that you ask what's important for your laboratory. What data modernization projects do they have currently in flight, and how stable are those projects? Do they need help? Do they need resources or funding? And how do the goals of the data modernization work that they're doing, help support the surveillance work that you do? All right, I want to kind of end here with words from one of the members of our subcommittee, Danae Hall. She is um, uh, basically the informatics manager within the Missouri Public Health Laboratory. She wears many hats, as we all do. But in her words, data modernization is not a single project. It is a mindset. It's something that is continuous, it's ongoing, it's not a project that ends after you reach a certain point. It's something that continues to happen every day at the laboratory. All right, and I think Ivan and I definitely want to thank all of the members of the Data Modernization Subcommittee. We wish that they could all have been an active part of this presentation, but they did a tremendous amount of work and provided a lot of input as we developed the survey and then analyzed the results and put together the report. And there's a lot more that is in that report, so I encourage you to read the full report. There's a QR code on this slide that you can use to access it. You can also go to the aphl.org website and look it up, and it is readily available. All right, thank you for your time.